Hi, I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare. Well, we're talking today about lupus, and Dr. Prather, you titled this The Heartbreak of Lupus.
Certainly.
Why call it the heartbreak of lupus?
Well, it mainly hits women from 15 to 44, so when you talk about kind of putting your life at hold in one of the most important parts of your, development, it's when you see young ladies who have lupus and just the suffering that they're going through and all the different types of things that occur, it is heartbreaking. Mm-hmm. You have a just a kind of like a desire just to hold them and comfort them and tell them it's going to be okay.
Right. Well, let's talk about lupus. What is lupus?
Well, lupus is an autoimmune disease, basically where the body starts to attack itself. So for some reason, the body has determined that some part of your system, normal tissue, is a foreign invader. And for lupus, the main area that we think that occurs is the bloods, white blood cells and red blood cells, is what the body attaches the antibodies to and has decided that that's a foreign invader, which causes a huge amount of effects throughout the system. That's one of the reasons that we mainly find the age from 15 to 44, usually during the time that women are producing menstruation. And there are times where through abnormal hormones, abnormal functioning, part of the menstrual blood can get out into the abdominal cavity. And when it does, then the body is designed to get rid of that. So it produces antibodies that cause white blood cells to come in and eat up the abnormal tissue there. But then when the body starts to say that all red blood cells, all white blood cells, are foreign invaders and starts to put antibodies on it, that's when you start to get the lupus. So there's an abnormality. In other words, the soldiers have turned on the citizens. And in the case of lupus, the soldiers are actually fighting each other. So pretty devastating type of a program, and something. It's a very devastating disease. So something that needs to be figured out and worked with.
And isn't lupus one of the other heartbreaks of lupus? Is it's very difficult to diagnose?
Oh, it's very difficult to diagnose. The interesting thing about the lupus is it's a great imitator. So it's oftentimes misdiagnosed. People think it's something else going on. Matter of fact, it usually takes about 6 years from the onset of symptoms to
6 years.
Yeah, that's the average that they find. And then usually they go through about 4 doctors before it's diagnosed.
So 6 years from the onset, finally getting it diagnosed.
Getting the proper diagnosis. And it's important to find the proper diagnosis to be able to get lupus under control, because it does need to be treated in a special way.
So are there different types of lupus?
There are. The most common one is systemic lupus, and that's more of a organ-involved lupus, where you start to have different parts of the body being attacked. It's about 70% of all types of lupus, and the main one that we're talking about. The other one is a cutaneous lupus, where all the symptoms are on the skin, and that doesn't cause any internal problems but can cause some scarring. So that's a difficult one. Also, there is a drug-induced lupus, where you're taking some form of a drug, oftentimes a sulfa-based antibiotic, and that can kick off a lupus, but it usually stops, you actually stop the lupus once you stop the drug. And then also a neonatal lupus, where the mother's antibodies are actually attacking the baby. So, but once, usually after birth, then that usually goes away.
So the one we're going to talk about mainly, and you said is 70% of the cases,
Right,
is called what?
systemic lupus.
Systemic lupus. Okay. So how common is lupus?
Lupus actually has about, according to the Lupus Foundation, has about 1.5 million Americans have lupus right now.
Wow.
And it is also something that hits mainly more women in childbearing age.
Okay. So mostly women.
Mostly women. 90% of all patients who are diagnosed with systemic lupus are females. And again, usually between the ages of 15 and 44 is when they're diagnosed with that.
And who gets lupus?
The interesting thing is that there's also a genetic component that also goes along with that. So if you have family members who have had lupus, then you're much more likely to get it. It also seems to be a stronger and more devastating in women of color. So Caucasians have the probably the lowest incidence of that, but Black, Latino, Asian women have a higher incidence of lupus than the Caucasians.
Okay, interesting. So what are the symptoms of lupus?
Well, lupus, the big thing that occurs with lupus is quite a bit of pain. It's something that people really suffer with. Trying to work with that is trying to get the pain under control is one of the main things that needs to be done. There's an extreme amount of fatigue, so you don't have a whole lot of get up and go. You can also have some hair loss starts to occur. Cognitive issues because of the spreading of it throughout the body, especially causing lowered oxygenation because of the attacks on the small arteries in the body. Physical impairment, cardiovascular disease. Again, it hits the red blood cells and can cause damage in the arteries. We also have strokes. It has a higher incidence of strokes. You can have some disfiguring rashes, which we talked about, and then very painful joints. So it's something that makes it very difficult to carry on your life, do your work, continue your studies. So it really cuts down on the quality of life.
Is lupus, you talked about a little bit that lupus has a genetic component.
Right.
Talk more about that.
Well, there are several different genetic markers that show up that it has a much higher incidence in certain type of people. So there are genetic markers that go along with that kick that up. One of the things, not only is it if family members have had lupus, also if other family members have had other autoimmune diseases. And oftentimes, if you have lupus, then you also have some other autoimmune diseases too. One of the more common ones is Hashimoto's for the thyroid, oftentimes goes along with that. So, really keeping your, again, it's an abnormality of the immune system, which is the soldiers of the body. And when the soldiers start to attack the citizens, that's when you get the autoimmune diseases. And systemic lupus is one that really spreads throughout the entire body and affects so many different types of areas. Trying to keep that under control and keep that from causing damage is one of the main things that needs to be done as you're trying to work with the patient along those lines.
Yeah, and I think, and we talked about the heartbreak of lupus, difficult to diagnose, but a lot of times is it misunderstood too? It
is. There have been a lot of women who've come in with lupus. The first thing that they're put on is antidepressants.
Oh,
there's oftentimes a feeling that it could be just in their head. They're causing different types of, mental stresses, things like that. And here, take this, and don't bother me. So, and then also just giving them pain release, which doesn't really help. One of the things about taking pain medications, especially opiate medications, is opiates are very good for the acute types of pains for the first 2 weeks, but opiates, especially with lupus, increase the pain level. So opiates are giving to patients with lupus anytime that you have a chronic disease like that. Opiates are the absolute wrong thing to take and will increase your pain level, not decrease your pain level. But then you also start to get the addiction. If you get addiction on top of the lupus, things can be a real problem. So misdiagnosis, prescriptions that are wrong, you can't really go along those routes. And if you have the diagnosis of lupus, it really makes it much easier to follow the medication schedule that you should be on.
Okay. When we come back, more on the heartbreak of lupus. You can win a free 60-minute massage in a relaxing spa at the Prather practice. Each month, we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather practice. Dr. Prather, tell us why your weight loss program is unique.
Well, we're not just interested in your weight loss. We're interested in your overall health and well-being. So, again, we are an office that is looking at homeostasis within the body. And homeostasis on your fat percentage is an extremely important part because that determines a lot of your pH, your hormones. It has a huge effect on how your body actually works. So we're not just looking at, yes, we want you to lose weight, but we want you to lose weight in a healthy manner. That
you'll be able to keep it off.
That you'll be able to keep it off. We don't allow people to gain their weight back. We really try to keep up with them and make sure that they have a lifestyle that maintains their weight, their desired weight. And then we also check to see what is the proper weight that you should be for the percentage of fat, because that is what is really important on this. And we also look at the whole person. What is it that's actually keeping you from being able to get where you want to be, whether it's emotional issues, whether it could be like we had a patient who was low iron. And that low iron was, they just couldn't lose weight until they got their iron levels back up.
Right. We see a lot of, thyroid, endocrine system.
Endocrine system that's out of balance. So we figure out what it is that's going to get you to a healthy state. And as you get to that healthy state, it makes it very easy then to lose the weight. And people are surprised at, that they're able to lose the weight and feel so much better. That's one of the beauties of all this.
And the other thing, too, it's very individualized.
Very individualized.
We have type 1 diabetics on the program. We've had people with type 2 get off their insulin.
Sure.
So with it being medically supervised and blood work is taken, so we know exactly what's going on.
Yes, we do. And that just makes all the difference in the world. And people have different types of, it's amazing how many different individual types of needs and quirks and all sorts of things that people have, and working with them to help them to get where they want to be is always a pleasure.
Schedule your appointment at the Prather practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather practice, restoring hope. A special message from the DTS Weight Loss Center at the Prather practice.
Are you tired of making the same weight loss resolution only to end up right back where you started? Let the professionals at DTS Weight Loss Center take all the frustration out of dieting. Our nutritionists and wellness coaches know what works for every body type and can develop a plan specific to your needs throughout your medically supervised program. Make the change by visiting us online at dtsweightlosscenter.com. Dedicate, transform, succeed.
When you call the Prather Practice to schedule your appointment at our DTS Weight Loss Center, mention the Voice of Health radio show and you'll receive a free initial consultation, plus a free body composition analysis. 317-848-8048. That's 317-848-8048. The DTS Weight Loss Center at the Prather Practice. Dedicate, transform, succeed. You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, the most comprehensive wellness center in the Midwest. We're talking today about the heartbreak of lupus. And Dr. Prather, you were talking about there are 1.5 million cases of lupus in the United States.
Diagnosed lupus right now.
Diagnosed. And out of that, 90% are women.
90% are women.
And you said the age range was from 15 to 44?
Is usually the onset.
Okay. Well, what can lupus cause death?
Yes, it can. The main areas that you're looking at for lupus is the lungs, the kidneys, stroke are some of the main things. You need to make sure that the lung function is staying up. Usually in the early stages, it can hit the lungs, and having the inflammation in there, you can get some secondary infections. So keeping the lungs clear from infections is one of the more important types of things that you need to do. Chronically, it's the kidneys. So kidney failure is very important, that you make sure that the glomerular filtration rate stays high and that you don't start to get into kidney failure. So that's the other area that you need to watch out for. And then, of course, it causes increase in cardiovascular disease, because as the antibodies, as the red blood cells are going through the small arterioles, you can start to get quite a bit of damage along those lines. That also cuts down on the cognition in the brain, because basically the body's not getting the oxygen it should.
Okay. So we talked about part of the heartbreak of lupus is that it's difficult to diagnose. How is it diagnosed?
There are 4 blood tests that are necessary to diagnose lupus. It's basically, as the doctor is suspicious of that, doing those different blood tests is where you can really find out the diagnosis, and hitting that is critical. If you don't do the diagnoses, then you can't come up with the
right.
So blood test is really the best way, and being aware. I had one patient who came into me who had a lot of the different types of signs of lupus, and then had a butterfly rash on her face. And she walked in, I said, looked at her symptoms, looked at her, and said, how many doctors have you seen? And she'd already seen 4 doctors for this. I said, has anybody come up with a diagnosis? And she said no, and I looked at, what medication she had been on. And I said, well, let's do some blood tests. And so we ran those and showed up positive. So we were able
Positive for lupus.
Positive for lupus. So we got her going along those lines, also got a rheumatologist involved, and then started her on a program. But again, it was just like, oh, thank you. I now know what I have, and then can take the appropriate actions.
Now, isn't butterfly rash on the face part of lupus?
Part of the yeah, it's one of the things that can give away a diagnosis. I mean, the butterfly rash might already be gone, but if there was a history of that, if I'm suspicious, did you ever have a butterfly rash? And she'd already seen four doctors and had that butterfly rash on her face. And I hadn't even...
You probably were already diagnosing her before the blood work.
Oh, I had already looked at her and pretty well knew how that was going to come out, just by glancing at her. And that's important to just be aware. And it's surprising that she had gone to that many doctors and hadn't really...
There was no blood work done?
Well, they'd done blood work, but no one had thought of the lupus diagnosis.
So you're saying there's 4 blood tests?
There are 4 blood tests that you can utilize for the lupus, and if we have a suspicion along those lines, then we'll run those.
Okay. So how difficult is lupus to treat?
Lupus, my mentor and a lot of the doctors that I go to and get training from, and we discuss things. When they talk about what diseases separate the men from the boys, in doctoring, it's lupus. Lupus is something that's missed quite a bit on diagnosis, and then the treatments are rather frustrating. You need to be very aware of how to work with that, because it is probably, a lot of people say it's the most difficult disease to treat. It's again, you talk about the heartbreak of lupus. The treatments at this point is definitely lacking.
Well, let's talk about that. How effective are medical treatments for lupus? It
is important to get with a rheumatologist and start a drug regimen when you do have lupus. I recommend that for all of our lupus patients. But as you are treating it, you need to know what drugs to avoid. Is one of the first things, because you can really exacerbate it and make it a much bigger problem than it is if you're giving the wrong pharmaceuticals. So that's one thing. And then definitely the recommendation is you take the minimum amount of drugs to treat this disease at this point. So you find out what pharmaceuticals are working and then give the minimum dosage. If you give too much with lupus, you can really set it off and make the problem much worse. So the pharmaceutical route, though, is necessary. You have to have someone who is aware who's done this several times with lupus patients and know that you should be using minimal amount of drugs to keep things under control. And right now, none of the drug regimens have a very much of a lasting effect. So pharmaceutically, it's very poorly treated.
Well, can structure function care be effective in the treatment of lupus? We at the Prather practice do structure function care. Can that be effective?
Yes. If you do have lupus, at this point, you really, really have to get involved with a structure function doctor, because the structure function care, approaching it from that route, is really where you can get some results and get some benefit for lupus patients. Now, structure function care shouldn't be done alone. We have a philosophy on how healthcare should be run. 20% of the healthcare program should be pharmaceutically based disease care. 80% should be structure function care. If we could achieve that balance, we could really solve our healthcare crisis and get much better results with patients. Especially in lupus patients, you have to have a structure function care doctor to be able to control lupus. Otherwise, you're not going to, the functionality of your body is just not going to be there. So structure function care is important for the ability to control the pain, the ability to keep the fatigue down, and to make progress on the disease. Structure function care has to be there. Now, you also need again, I want to emphasize, and I always tell my patients, you can't just rely on structure function care. You need the disease care along with it, but it should be minimum, especially in lupus.
Okay. When we come back, we're going to talk about that structure function treatment for lupus. Listen to the Voice of Health Radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
I was watching the other day, y'all, and they had open heart surgery on the Discovery Channel. It was fantastic. They laid this old boy out on the table, and thank God they can do that. If I keep eating Mexican food, I'm gonna eat it. They put a towel over his head. I guess so in case you knew him, you wouldn't get sick. And they cut him right down the middle. They ripped that chest cavity apart. And there it was. Looked like lasagna that was alive. It did.
Well, I'm joined today with Lisa Kelly, CEO of Lupus Foundation of America, Indiana chapter. Well, what events do you have coming up this fall?
So we have our In the Loop Living with Lupus, Healthy Living with Lupus Symposium on October 27th. That's at the Crowne Plaza Airport Hotel. And we have 8 incredible topics and 7 speakers, including Dr. Prather. And he will be speaking on understanding the natural process of lupus and also alternative methods for maximum health, which will include acupuncture and essential oils and chiropractic care. Then another one we're really excited about is CBD oil for pain management. That'll be one of the topics this year, as well as depression, stress, and anxiety management. So all of these topics are again available on our website, lupusindiana.org, and registration is only $20 for lupus patients, but we do have scholarships available for those who have the need.
Wonderful. Thank you, Lisa.
I was feeling so bad. I asked my family doctor just what I had. I said, doctor.
I'm Lisa Prather, and you're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where we get to the root cause of your health issue. We're talking today about the heartbreak of lupus. And Dr. Prather, let's talk now about the treatment for lupus. We practice structure function care at the Prather Practice. And let's start with, how important is diet in treating lupus?
Diet is critical for any autoimmune disease. The reason is that 80% of your immune system's around your gut. And so the gut plays a very big role in the autoimmune reaction. If you can reduce the stress if you can take away all the stress from the gut on the immune system, you don't have an autoimmune disease anymore, because you're removing 80% of the stress on the immune system. And all autoimmune diseases because of overstress of the immune system. So looking at the gut is highly important. One of the things that we do for that is we do a GI stool kit and analyze, find out what the stressors are on the gut, and then work with it accordingly. But diet is very, very important. You want to have, for lupus, have a low-calorie, low-fat diet, especially animal fats. You want to avoid. The other things that are important for the diet for lupus that you can just be thinking about is really cutting out beef and dairy products because of the high fat content involved in that. So, if you can just eliminate those things, you
dairy
do much better. Dairy and beef especially. Do food allergy testing. That's one of the things that we recommend for all autoimmune diseases, especially lupus. So find out what foods that you're reacting to, eliminate those. Going on a food rotation diet where you don't repeat foods until the 5th day. When the immunoglobulins in the body are produced every 4 days, and after 4 days they die. So the life of an immunoglobulin. So if you eat something one day and you have an allergic reaction to it, and you have an immunoglobulin production, or it's not really until you have it the second time that the body starts to make antibodies to that.
So it's like not reintroducing a food
until the 5th day, because then the immunoglobulins have died. that particular diet really can cut down on the effects and the symptoms of lupus. Matter of fact, you can get amazing results. If you can get someone to follow that diet, you've oftentimes you can actually get a cure for an autoimmune disease. We don't like to say cure, definitely go into remission. But if you can do that particular diet, it has a huge effect on all autoimmune diseases. So something very important to keep in mind.
And we do that at the Prather practice, the food allergy testing.
And we come up with a diet for people that they can maintain. And it's hugely benefit.
And most insurances do cover it, which is nice.
And we do check on that and see which ones, because we have a lot of different types, a lot of different food allergy tests, so we can find out which one will work the best with your insurance. No alfalfa. Do not eat alfalfa. Matter of fact, alfalfa has a chemical in there that can cause damage to the red blood cells. So it can kick off an antibody to red blood cells and then kick off lupus. Again, we talked about how the antibodies to red blood cells is basically what kicks off most lupus. And alfalfa is known to do that. And if you take alfalfa while you have lupus, the symptoms go right through the roof, or even eat alfalfa. So alfalfa is like a huge, big no-no.
You find that on salad. I'm trying to think.
Yes, salad. As a matter of fact, I had some alfalfa yesterday when we went out to eat.
Okay.
There was some alfalfa in my meal. So being aware of that, and I have had a couple of different lupus patients who had really decided to go real natural with their diet, and one just thought, I had read that alfalfa sprouts are like one of the best things in the entire world for your health. And
for everybody's health, right?
Right. And she went for that and couldn't figure out why everything had become such a disaster. So I told her that, alfalfa is just, and gave her the reasons and some of the literature on that. And she goes, oh my gosh. Why didn't anybody tell me this?
Right.
And had a dramatic improvement in her health. So alfalfa is an absolutely huge no-no. Another thing is testing for hydrochloric acid deficiency is another thing that, because if you have poor functioning hydrochloric acid, it increases your food allergies, which increases your autoimmune disease. So one of the ways that you can get the food allergies under control is to increase your hydrochloric acid. Hydrochloric acid breaks down the food into smaller particles. The smaller the particle, the more it's broken down, the less allergens that the body reacts to. So hydrochloric acid is very important.
How do you test for that?
We do have different types of tests with the labs just to check on the hydrochloric acid. So, and then again, one of the things that I always say is there's usually other autoimmune diseases, and getting those under control. Oftentimes there's Hashimoto's, which is a low thyroid. So once we can get that under control, we see some improvement in the lupus symptoms also. So treating the whole body is one of the more important things to do.
So what nutrients should be checked, on for helping with lupus?
Sure. The ones that are really well known that are common in our patients with lupus problems is niacin, pantothenic acid, vitamin A or beta carotene, vitamin B12, vitamin E, selenium, sulfur. The essential fatty acids are also usually low. You don't want to get your fatty acids from the beef and dairy or the animal, but getting other essential fatty acids is essential for helping with that. L-tryptophan also has quite a bit of help, which is amino acid.
Interesting. So supplementation is very important.
Supplementation can really make a big difference in the symptoms and some of the damage that goes on through the body. One of the things is you also need to keep the damage to the kidneys under control. Arginine, kidney glandular is very helpful. some of the herbs are also very helpful along those lines.
Yeah, let's talk about that. What herbals have been shown to be effective for lupus?
Well, one of the occurrences that happens when you have lupus, and why it's important to check on the gut, is that lupus patients have a higher incidence of parasitic diseases. We're constantly being exposed to parasites, and so the parasitic infections can start to occur because of the weakened immune system, and they do increase the symptoms of lupus quite a bit. So I can pretty well any patient that I've had with lupus, any chronic type of patient, all have had parasitic infections. So checking on that, getting those under control has really helped with a lot of the symptoms. So taking some anti-parasitic herbals are extremely effective. Black walnut, golden seal are some of the ones that are more commonly known. Also, gotu kola is very good for the cardiovascular system, so hitting that is very helpful. Bromelain, again, working on the cardiovascular system. It keeps the arteries clean, keeps the oxygenation up, and especially helps with cognition. Cayenne pepper actually is very helpful. We also have a herb that is very well known to be utilized, Gelsemium elegans. It has actually a better effect and longer lasting effect than the pharmaceuticals to control the antibodies. Remember I said that was important. You want to stop the antibody production, and with the Gelsemium elegans, also known as Thunder God Vine, is extremely effective on that, but it is something that you need to be very careful with. One of the ways that we work with that and how we can utilize that is in a homeopathic form, and that can really help with the symptoms and the antibody production, and oftentimes can work quicker, more effectively than the pharmaceuticals that they use to control that.
I'm not going to have to spell that, right? We carry all those herbals at the Prather practice, and let's talk about homeopathics. Their importance in the treatment of lupus.
Yes, and homeopathics are probably, as I always say, are a secret weapon, and that's really where we get the best results. And homeopathics in all of our autoimmune diseases is probably one of the most important things that we do, because I always like to, because people don't understand why homeopathics and how they work, but I always like to, people are very familiar with allergy shots, where you take a small amount of something and then give it, and then desensitize the body to that particular, like if you have hay fever, molds, you can take a shot along those lines. And as you do that, then you can desensitize and stop the immune reaction. So the same thing with homeopathics. We can take a homeopathic and the allergist got the idea of allergy shots from homeopathy. It is a form of homeopathy.
And we talked about homeopathy last
time
for our radio listeners. Yeah.
And so homeopathy, especially in autoimmune diseases, should be a very, very important part of the treatment. So homeopathics are absolutely essential for autoimmune diseases. We have a whole list of those that we test out and then utilize. There's about 3,000 different homeopathics that you can use, and we find out which one's going to work the best for them and then get some really good results with that.
Okay, when we come back, more on the treatment of lupus. Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice.
I consider the blood work to be the blueprint to your health, and we've had several different radio programs on that and talked about how important it is to have at least a yearly complete blood test to find out where you are. The blood is the life force of the body. And it gives an amazing chemical picture of where you are with your health and can actually pick up all the different types of diseases that could be going on. So having a thorough blood test is one of the most important things and is recommended by everyone to make sure that your health is up to where it should be and can actually pick up any type of disease process before it becomes a major factor. So having a good blood test, a good thorough blood test, is one of the most important things that you can possibly have. One of the things that I implemented when I started my practice was a blood test that could actually cover any type of problem that was actually developed that someone could actually experience. So we came up with a profile, we gave it to the labs, but they said, wow, that's a pretty good profile. Do you mind if we offer that to other people? And I said, no, that would be fine, because I feel that that's something that could be very useful. And they named it the Prather profile. So I've actually met with other doctors before and talked to them and said, "You're Dr. Prather. Are you the Prather of the Prather profile?" And I said, yeah, because, they get a list of different profiles. And so it's actually now a national profile. So we actually have 52 different lab tests that are actually included in this profile. It covers everything from A to Z. In other words, any disease process that you could possibly have in your body, that will be covered by this particular blood test. So it is something that should be done by everyone, from no matter how young you are to no matter how old you are, at least once a year, to see what your health is. If you have a problem, this will actually pick it up. And one of the nice things about that is it is actually covered by insurance. So very excellent way of actually finding out where you are, and if there are any hidden types of problems that are going on, this will actually show it up.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope. We want to invite our radio listeners to join us for a very special screening of an award-winning film called Just One Drop. This special movie event will be held on Wednesday, November 7th at 7:30 p.m. at the Regal Village Park Cinema in Carmel. Homeopathy is a specific form of medicine that uses minute doses of highly diluted substance that stimulates the body to cure itself. To many, homeopathy seems implausible. They fear it is a placebo effect, or worse, a form of deception or quackery. Yet, homeopathy has been around for over 200 years and is used by millions worldwide. The film, Just One Drop, explores the controversy, dispels the misconceptions and the myths, and asks whether or not homeopathy has been given a fair shake. The Just One Drop special movie event, Wednesday, November 7th at 7:30 p.m. at the Regal Village Park Cinema in Carmel. Learn more about the film and buy your tickets now at thevoiceofhealthradio.com. You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where our mission is restoring hope to our patients. We're talking today about the heartbreak of lupus, and we're talking about the treatments that we provide at the Prather Practice for lupus in the structure-function healthcare model. And why is chiropractic important for lupus patients?
Pain. One of the main things that is debilitating is the pain level. My lupus patients that come in are just shocked at how we can get how important the chiropractic is to their pain levels. One of the things is I've been asked to speak at a lupus convention and talk to them about that, and it was just from the recommendation of the patients. Because how do you get the pain under control if you don't really have effective pain medications that can help with that? The chiropractic adjustments has an immediate effect. All my lupus patients, as soon as they come in, get adjusted, are like, wow, it is so great just to have that time out of pain. And the joints are very, very painful in lupus patients, and some good chiropractic adjustments are very, very important along those lines. One of the things is that people, for those of people who are out there and thinking about, have a mental image of what chiropractic is, you have to be gentle with lupus patients because they are very sensitive. So it's not a rough adjustment. There are about 40 different styles of chiropractic out there, and many of them, we use about 6 different styles within our office. We have some extremely gentle types of means of adjusting, and most patients with lupus through the chiropractic adjustments can feel about an 80% improvement in their pain level, and very, very important.
Yes.
Not only does it do that, but also chiropractic has a excellent long-term type of benefit because the hormones plays a big role in the long-term outcome of lupus. We had talked about that the menstrual cycle was very involved with kicking off lupus. One of the things is endometriosis is considered one of the precursors along those lines. And the nervous system and the endocrine system are completely interconnected. And women with endometriosis and lupus can see a difference in their symptoms associated with that. I have one of my staff members has endometriosis, and she if she doesn't get her regular adjustments, then things don't go well. Matter of fact, we have our adjustments pretty well timed with her menstrual cycle to keep things under control. And so the chiropractic adjustments are extremely helpful with pain, but also helpful with the long-term effects of lupus too.
Okay, well, let's talk about acupuncture too, and what role that plays with lupus.
Acupuncture, the things because people say, well, how does acupuncture work? It works on the electromagnetic energy of the body. The electromagnetic energy is very much involved with the inflammatory process and also the healing process. If you have poor electromagnetic energy in a certain area, you get very poor healing. Matter of fact, if you have a cut and you use acupuncture needles, the cut will heal twice as fast if you use acupuncture. We have people who come in with scars that are 20 years old from surgical procedures, very bad ones. We use acupuncture, and we can completely eliminate those scars. So acupuncture is very important to keep the inflammation, keep the healing going well. So we get some really nice joint changes because of that. Acupuncture has the best effect on infertility of any treatment out there. And the reason is because it cuts down on the inflammatory process in the ovaries, fallopian tubes, and uterus.
I know, I feel like acupuncture is the best thing for inflammation.
It is.
And when I think of lupus, I think of
an inflamed individual.
When I picture the people with lupus is inflammation.
Inflammation, and you know, if we have a damaged ankle, damaged low back, and it's very inflamed, I have their people who are with them, you know, who come in to observe, wise husbands, and I put the needles in, and I say, now watch that area as we've done that, and within 10 minutes, you can see the swelling has gone down. Mm-hmm. It works that quickly. So acupuncture is very, very helpful along those lines. And again,
we do needle and non-needle.
Yes, we do needle and non-needle. Sometimes one is better than the other. Mm-hmm. And we can get some really amazing effects working with the electromagnetic energy of the body.
Right. Let's talk about auricular therapy and how that helps the symptoms of lupus.
Well, the auricular therapy is designed to work on the pain centers in the brain. Mm-hmm. As you have pain on a constant type of basis, it gets the even when you've eliminated the underlying cause, the pain can still be registering in the brain just because it's used to doing that. So the way that you break that is auricular therapy. Auricular therapy, you can basically, I tell people, rewire the brain and really cut down on the pain patterns. So auricular therapy is excellent for pain reduction. Matter of fact, one of the things that we offer is where people walk around with an auricular therapy device, mm-hmm. and it is approved for pain, for neuropathy, fibromyalgia, lupus, many of those different types of chronic conditions, mm-hmm. because it does work very well.
Mm-hmm. Let's talk about the ECP, or external counterpulsation therapy, and how that can be helpful too for lupus symptoms.
Well, one of the things is that people have the reduction of oxygenation. Mm-hmm. That's why they get the strokes, cardiovascular disease, because of the damage to the small vessels. And ECP is a cardiac rehab where we get some pumping, and it pumps the arteries and cleans that out. For our lupus patients, there's just a general ache throughout the body. We had a young lady who came in just recently and just sore all over. You couldn't touch any part of her body without pain. And we started her on the external counterpulsation, and afterwards, all that pain was gone. Mm-hmm. Also, it really helped out with the fatigue, with the cognition. Mm-hmm. Because she wasn't thinking very well, and all of a sudden she said, I can think again. Mm-hmm. And so the external counterpulsation therapy can really rehab that and keep that under control and keep the arteries healthy, especially the small arteries, during the attacks of the lupus. I remember that this patient you're talking about, they actually came up from Texas, mm-hmm. and the first day she smiled. Right. Yeah. Because she started could tell feeling better. Right. Mm-hmm. Right. What about lymphatics? What is the lymphatic system's role in lupus, and sure. How is that treated? Well, the lymph system swells up. The spleen can swell, the lymph nodes, and that's a very common type of thing. We had one patient whose lupus, whose lymph system was very, very sore, and we went after the lymphatic system with some herbals to help out with that, but then we treated it directly. We had a lymphatic massage. We also did diathermy, which opens up the lymph system. Mm-hmm. Got that going, and then that really made a big difference. Mm-hmm. All of a sudden, she could really function. The lymph system was down. You could actually see the swelling decrease. It even lost about. The next day, she weighed 2 pounds less, mm-hmm. because she had gotten rid of all that fluid that had accumulated in the lymph system. Yeah. So lymphatic pain is a very major issue. Keeping the lymph system clear is extremely important because it cuts down on infection. And then you see an improvement in the immune system and how it's functioning. And so the overall reaction of the lymph system, of the lupus, is decreased. Yeah, what I like about structure function medicine is there's so many treatments in our arsenal. Right. Mm-hmm. Yeah, and it can be effective. And that's one thing that all of our patients have really said, that they just appreciate all the different ways that we're approaching it, mm-hmm. and then coming up with the one that really works for them. Right. Well, thank you, Dr. Prather. They're very informative. Thank you, Lisa. The Prather practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048.
Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather.